Fixing knees with human cartilage is giving patients more options and better outcomes.
And now doctors are able to help people with knee trouble grow their own cartilage. WGN's medical reporter Dina Baer has more on the procedure. Dina?
Allison and Steve, imagine having knee pain, bone rubbing on bone, knowing you need help, and doctors saying, we can help you, help yourself. For patients with specific knee problems, cartilage regeneration may be the answer to normal knee function. 3 years ago, Kevin Hoffman couldn't even think about getting on this treadmill. Every step would bring pain.
It came to the point where basically you get bone rubbing on bone, and it just is very uncomfortable.
After several knee surgeries, his doctors said they couldn't fix his articular cartilage.
This is the white, glistening cartilage that you may see at the end of a chicken bone, for instance, that goes on, if it's damaged or injured, to develop what we call osteoarthritis or degenerative arthritis.
But Hoffman wouldn't give up. He went to see Rush, Dr. Brian Cole, and realized by coming here, he had gotten one step closer to a cure. Not a traditional knee replacement, but a personal knee relief.
I could choose to have a plastic joint in my knee or really take my own cells and have them put back in and have a functional knee.
Hoffman chose cartilage regeneration.
We take a small swatch or biopsy of the patient's own cells through an arthroscopic procedure, and then we actually will culture those cells, expand them to a very large number. They are then subsequently implanted into the knee through a second procedure underneath a little patch that we sew over the defect, almost like a manhole cover, and sort of creating a fill for the pothole that exists in the knee from the previous damage.
Hoffman was on crutches for 3 months after the procedure, and recovery took even longer.
However, it may take upwards to a year to 18 months to resume normal function.
A long recovery, but with lasting results. Dr. Cole says up to 90% of patients who underwent cartilage regeneration saw success. Hoffman is living proof it works.
The most important thing for me was to have an active lifestyle. You know, I have a family history of heart disease, and I need to stay active and to get the aerobic exercise, and this gives me the ability to continue that.
Dr. Cole is currently looking for patients to participate in a clinical trial. People who have had other treatment for articular cartilage problems and now have a recurrence of symptoms. If you're interested, contact Rush on Call. It is a pretty amazing procedure.
It is.